Yeah, so how are those conversations approached then with family, either about the potential withdrawal or then organ donation stuff? Who does that? And
it'll always be a consultant and a bedside nurse at the time.
Okay.
So they'll take the family off to the quiet room. They'll have an initial discussion with the family where they sort of set the scene, and they'll always, I think guidelines have changed recently, but they will always try and make sure they include certain terminology to make sure the patient's family are very clear that we're talking about imminent death, because I think they're finding if they didn't use the word death or a sort of derivative of that word, that sometimes there was a misunderstanding of where the direction of treatment or lack of treatment was going. But there'll always be a consultant and the bedside nurse. So they'll have an initial conversation, then there tends to be a second conversation at a later date, or if different family members need to be informed. It tends to be a sort of process rather than a one conversation. And then I think the SNODs tend to get involved, the organ donation nurses, at that second or third discussion, never the first.
I think in our unit we've taken the stance very much that we don't want the family to think that we're trying to get their organs. And I think that the perception of having a SNOD involved, because I think that the organ donation, the way organ donation is going, is very much more on the trying to get the organ donator people involved earlier in making those decisions. And I think in our unit, particularly this is only our unit, we've taken very much the stance of saying, well, no, we feel that we want to tell the family, prepare the family without having the organ donations there, because of the fact that we don't want them to think that we're purely trying to grab someone's organs, you know, and that's not what we're about.
Yeah.
You know,